We're the mesh between health and social care. So in a world today in 2021 where the lines of care is broadening, we're the mesh that connects all these organizations from healthcare, government, and social services together, so that ultimately the client in needing all these different services doesn't have to access them individually and in a fragmented way. And so the way we do that is we build these coordinated networks across states, across the country now in over 45 states that tie these organizations together, that to allow them to securely communicate with each other around that shared client. And most importantly, solve the need. They can prove that the client got the services outside the four walls of the organization, which no one could ever know because they were all in their own systems or doing their own thing individually, but never knew that. So that's our flagship product, the platform. Hundreds of thousands of users from healthcare, government, social services. Part of that work is who builds the network. And so what is a network? And so we focus on two things: quality and accountability. So when someone joins our network and organization, from a housing organization to a hospital, they're going to be accountable because they're part of a system where everyone is connected around that client. So the client doesn't have to navigate themselves. And part of that work is actually building the network ourselves with our customers and our partners and communities. And so we have over 300 people on the ground across the country, a part of our 1,000-person company, that are engaging and building and managing this network with the community, so that we hire locally, they understand the community, what organizations need to be on to meet the demand, get those organizations on our platform to communicate with each other, work with them around data and reporting, elevating them to the next level of coordination, which really didn't exist before us. As we've grown as a company, that flagship product has continued to grow in its practice, but also we've added new products on top of that, from predictive analytics to actually helping with a staff of social workers to enroll people in our own network, and then to a payments product that actually reimburses these services for the services that they provide that improve people's health and lower healthcare costs.